Thank you very much, Eric. It's a real pleasure to present here Icometrix to all of you at the Amazon booth, which is an important partner for us, as will also be more clear throughout the presentation. So, just telling a little bit about Icometrix first. Icometrix is a company that is based in Belgium, but also an office here in Chicago. We currently have 45 people on board, and our mission is to make patient care better by using imaging AI, and then particularly in the field of neurology. Today we have 5 cleared products in the market already, and recently we have raised $18 million to support our further growth. And we have always chosen to be a cloud-only model, so all images that we process are sent to cloud in which they are processed. And this is really why we're doing things. Almost 1 in 3 people in the world suffers from a neurological disorder in his life, so that's a huge amount, and it's expected that this will even raise in future. As you can imagine, diseases like dementia, they are growing, unfortunately, in numbers of patients. And that also reflects in the number of brain scans that is acquired. So approximately 500,000 every day scans are acquired. And what is stunning is that almost 1 in 4 of these reports for these brain scans contain important errors. And that's what we want to improve with our software. So that's why we have developed a software called Ico Brain. And you can see Ico Brain as a kind of first reading of a brain scan, a brain MRI scan, a brain CT scan, after which the radiologist continues the reading and has less errors and is more consistent with other readers. So we make the productivity of the radiologists working with us higher. We improve the diagnostic accuracy, the sensitivity to pick up disease activity. And in the end, and that's also what we have proven, is that we are able to improve the patient outcomes, something that really matters to us. So just to be a bit more concrete, we enhance productivity with 60%. We improve the diagnostic accuracy by detecting disease activity that is almost invisible by human eye. We reduce the intra and inter-rater observer variability, and we have been able to demonstrate that the patient outcomes have improved, the quality of life have improved, especially for patients with multiple sclerosis. And all of this is built on a strong publication record. At Icometrix, we have been able to publish over 130 scientific publications. And as you might be aware, there's many AI applications today available in the field of radiology. But what is important is that they have sufficient validations. They are peer-reviewed by the community, and that's also where we have been focusing on. And for that reason, also a lot of pharmaceutical companies work with us. They have a strong scientific focus, and they work with our software in their trials to make their trials also more effective, have more power in the trials. And that's all using the power of cloud. And this has a big advantage that there is no installation cost, there's no maintenance costs, no support fees, and there is also no downtime if you use a good cloud provider. And we work like this. Images are acquired everywhere in the world on the local scanners. It can be MRI images, it can be CT images. They're sent to the Icometrix cloud, which of course we use a cloud provider for, which is Amazon. And results are sent back into the local infrastructure of the hospital. And all of this happens before the radiologist starts reading the case. So what's the advantage here? I already mentioned briefly on that. We can do automated updates. So basically our software every month gets updated. We have a support team that is looking at the images and is able to already communicate with our radiologists errors before the radiologist sees the errors that might be happening during the process. So that's also a huge advantage of going into cloud. Also, we are at Icometrix are responsible for the uptime and the security, so that is also easy for the departments, especially the IT department. Also, cloud infrastructure really allows to boost the computation power. It's almost impossible to think that what is possible in cloud is feasible in local environments. And also, as Icometrix is growing, we need scalability, and that's also possible via cloud. We at Icometrix have also been focusing on cybersecurity. That's why our company has received the ISO 27001 certificate, which is very important in the cloud environment, because security might be one of the questions that is raised when software is offered via a cloud application. We get frequent audits in this context, and we are also happy that Amazon, the AWS, has the necessary security measures easy to implement for a company like ours. So that brings me actually to what we actually do for our clinicians, for the radiologists, and that's shown on this slide. We provide them with quantitative measures that help them make better treatment decisions. And we do that for different applications. We have Ico Brain MS for helping patients with multiple sclerosis, especially for the follow-up and to give them better treatments. We have Ico Brain DM, which is helping in the differential diagnosis of dementia. And we have Ico Brain TBI, which helps with the treatment decisions for traumatic brain injury. As an output, we provide these concise reports, and we compare the numbers with databases of normal, healthy persons to really give better insights to the neurologist working with our software, and it helps for a radiologist to compare his patient with all patients everywhere else in the world. Besides that, we give also back annotated images, so radiologists can also qualitatively review our software output, and we give back natural language reports, pre-written reports that make the radiological reading much faster and much more consistent. These reports are based on templates used in Stanford University, New York University, Vall d'Hebron in Barcelona, and university hospitals in Leuven. And together we have come up with a template that is consistent for all of these hospitals and is pre-populated by our software. So you can imagine a big time gain there. So this is a particular clinical case of a 26-year-old female with multiple sclerosis. She had problems with her extremities and went back to the doctor for getting feedback. And what's interesting is when you look at the images, it appears that there is a lot less lesions, and that's also measured by our software. So there is a decrease in lesions. But on the other hand, there is some other parts in the brain, there is new lesions. And this is typically missed by a radiologist because he focuses on the decrease of the lesion. Whereas on the other hand, there is also some increase. So this is a clear case where there is disease activity present. And that's, for example, indicated here. More specifically, there's a new lesion, it's nicely indicated in red, and there's enlarging part of the lesion which is indicated in yellow. And this is then also translated in a pre-written radiological report with all the information there that makes the reading much, much faster and also more consistent. So we have done a study that compares the productivity when using our software and compare it without using the software. And without using the software, the radiologist could read 8 reports an hour, which I think is already quite impressive if you ask me. But the nice thing is when using our software together with these pre-populated radiology reporting templates, the productivity raised, and now 13 reports could be read every hour. So this is a significant increase, and also it's important to understand that our software takes over some of the tasks that might be quite cumbersome for the radiologist. Measuring lesions, following up lesions over time. This is not the work that a typical radiologist likes to do, so the software takes over part of his job. What's also interesting is that it's not just only faster, but also much more sensitive. So on that same cohort, without using the software, there was progression, disease activity noted by the radiologist in 24% of the cases. But when using the software, there was 44% confirmed disease progression. And if you look at the software, it's also possible to look at small disease activity, like a minor disease activity that might not lead to treatment change yet, but the neurologist could decide to follow that patient more closely. So this is important. There is 20% more disease activity found when using the software, and also slight disease activity is now also possible. So this is an increased sensitivity. And what is nice, recently there have been published treatment guidelines. In 2018, 2017, new treatment guidelines have been published for multiple sclerosis. And the most progressive one is the NIDA-4 criteria. And when using our software, it is really possible to apply that in clinical routine. And this is important because today, 1 in 4 patients is on the wrong medication for him or her. And unfortunately, because the disease is quite slowly evolving, it takes a long time. More specifically, almost 4 years before it is noticed that this patient is on the wrong medication. So when using the NIDA-4 treatment guidelines, together with a more sensitive reporting, we have shown that this time of about 4 years could be reduced to 15 months, which is about a bit more than a year. And this is very important, because MS patients, they lose disability. They lose ability, so they have more and more disability, and it will never come back. So it's very important for them to get the right treatment as early as possible. So there's a huge time that is won when using the software, and this is an important difference for the patient. So that was, let's say, our flagship product, which is our product for multiple sclerosis. We have also a product for dementia. I will not dive into the same details as I did for dementia, but for MS, but I wanted to touch on our dementia product. It looks like this. It is a 2-page report where we quantify important structures: the frontal cortex, the parietal cortex, the temporal cortex, and the hippocampus. And the volumetric quantification of these structures allow to do the differential diagnosis between different diseases that cause dementia. For example, the signature that you see here is a typical signature for an early Alzheimer's patient. The patient has an abnormally low hippocampal volume, and that's shown because the hippocampus is here in the blue zone, whereas the other structures are still normal. This is very typical for an early Alzheimer's patient. It's impossible to see that with human eyes, because it's shown that an atrophy of 5% is the most sensitive, the highest sensitivity that is possible by human eyes. So this is taken over by software, and it's very easy to see. On the other hand, we also measure the lateral ventricles, the whole brain volume. This allows to detect normal pressure hydrocephalus. It's not occurring that much, but it is a treatable form of dementia, so it's important that this can be ruled out. So here's a clinical case, 65-year-old patient with initial diagnosis of prodromal Alzheimer's disease. But after analyzing the scan with our software, it became clear that there was an abnormally high frontal cortical volume loss. And this is very atypical for Alzheimer's disease. In Alzheimer's disease, typically, the frontal cortex is preserved the most. So basically, this gave the reason to rethink the diagnosis, and it shifted to a possible frontal temporal dementia. And there were some clinical symptoms and some CSF punctures were done. And then the diagnosis became the behavioral variant of frontal temporal dementia. This is just a use case, but this is, of course, occurring in many directions, from Alzheimer's disease to frontal temporal lobe dementia, vascular dementia, or even treatable forms of dementia like normal pressure hydrocephalus. Then the last product I want to speak about is our Ico Brain Tbi Report. This is a report for traumatic brain injury in an acute setting. So the patient comes in, he has typically a severe traumatic brain injury. And what we see in practice is that there is a lot of variation in how these patients are treated. But luckily there have been developed CT scoring systems. These CT scoring systems allow to assess the patients in a much more standardized way. And for that reason, we quantify some parameters to better assess whether a surgery is needed or not. So let me dive into that. We measure the mass effect of mass lesions. So we do the volumetric quantification of the epidural, subdural, and intraparenchymal hematomas. And this is important because, as you probably know, subdural hematomas are less likely a reason to do an evacuation of the hematoma compared to, for example, an intraparenchymal hematoma or an epidural hematoma. So this is important information to be taken into account. Also, the cisterns are measured. And we compare that again with a healthy population, so we know whether the cistern is compressed or not. We also measure the ventricles, again to look at compression or to look at obstructive hydrocephalus. And this is typically measured with our lateral ventricle asymmetry index. This is an indication which you can see in this particular example with a compressed left ventricle, but a right lateral ventricle that is slightly enlarged. This is typical for an obstructive hydrocephalus. We also measure the midline shift. As you might know, if there is a midline shift more than 5 millimeters, this is according to the treatment guidelines of the Brain Trauma Foundation, a reason to do a brain surgery, craniectomy. So again, this information is all there in a couple of minutes after the acquisition of the scan. So with that information, you can make your report much faster. It contains quantitative information that the referring neurosurgeon or neuroradiologist neurologist can use to make better treatment decisions. Here are some segmentations that we also provide back. For example, here is the hyperdensities, which are the hematomas. There is the segmentation of the cisterns and the segmentation of the ventricles. Because this will give you, hopefully, some more confidence that the measurements that were done by the software were correct. And this is what it can really mean for that particular patient. If you look at the NIRIS score, which is developed at the University of Stanford, for that particular case, it had a mass lesion of more than 25 milliliters, which is a NIRIS score of 4, which then has the patient management action to consider a neurosurgical procedure. Of course, this is something that you would probably see by human eye as well, but think of these borderlines, NIRIS 2, NIRIS 3. The software can help you in making more evidence-based decisions on whether to go for surgery or not. And what's also interesting for this particular patient, it gives an idea of the outcome prediction. If you use the CT scoring system of Rotterdam, developed by Dr. Andrew Maas, we see that this patient has a probability of mortality of 53% in 6 months. So this is important information to make treatment decisions, but also to communicate to the rest of the family. If we use the Helsinki scoring system, the mortality rate is expected to be 22% in 6 months, and an unfavorable outcome, so that's an outcome of a vegetative state, is 49%. And using the Marshall classification, which is the oldest classification, it gives a mortality rate of 53%. So this information is all at your availability at the moment, just a couple of minutes after you have acquired a scan. And if you follow the surgical guidelines, in this case published by Bollock and adopted by the Brain Trauma Foundation, this is also a reason to do a surgery. So that was in a very nutshell what Icometrix is doing. I also want to show you some of the aspects that we're doing here at RSNA. So we have some speakers at our booth, so in case you would be interested in learning more about the TBI product, we have Professor Max Wintermark from Stanford speaking on Tuesday at our booth. We have Dr. Tannenbaum as well, Dr. Susie Besch tomorrow, and Dr. Johnson. They will all speak at our booth to also tell how they experience the use of our software in their clinical routine practice. because I'm, of course, biased as I work for the company. These clinicians use it in routine basis, and they can help you understanding better how they use it. Also, we are committed to helping MS patients, so at our booth, you can help us donating to the MS Society, also a reason maybe to stop by our booth. And of course, we have a nice team. It's pretty small, but we have a nice team here at the booth that is willing to help you with any further questions if you might have afterwards. So feel free to go to our booth, which is also here in the AI Theater. So with that, I would like to thank you all for your attention. And if there would be any questions, I'd be very happy to try to answer them. So thank you. Thanks a lot.